perhaps even more important than the global inequities that we're all aware of. We're aware that the majority of kids dying under 5 or women die in Asia and Africa. What's even more important these days is the national inequities, inequities within countries. This is a photo that we took during a survey of maternal mortality in Afghanistan, in the rural north of the country. These are the results of the survey. I'll just explain what they mean. Maternal mortality ratios are actually very, very hard for the average layperson to readily understand. So what I'm going to do is explain them in a way that's easier. That Badakhshan number, 6,500, that's per 100,000 live births as a denominator. If I give you the figure for the Western world, it's about 1 in 8. So actually, if I transfer this to lifetime risk of dying of women, in Badakhshan, that transfers to a lifetime risk of women of 1 in 4. 1 in 4 women having a lifetime risk of dying due to pregnancy-related causes. If I compare that with the safest place in the world to deliver a baby, that's Ireland, the lifetime risk is 1 in 48,000. But look at the difference between Badakhshan and Kabul. Orders of magnitude between even urban Kabul with all of the problems that you know about and read about every day in the newspapers compared to rural Badakhshan. I want you now for the challenge to focus on one country, and that's India. India, obviously in your world, is an important player, the home of many innovations. But India is also responsible for more than 20% of all under 5 deaths, more than 20% of all maternal deaths globally, about 20% of all primary-age children that are out of school, around 30% of the population not using improved sanitation, 40% of all underweight children globally, and 40% of all child brides are all in India. This is an example of how not to present data to the general public. But if you look at the second column, under 5 mortality, what you can see there is the state-by-state disparities in India, ranging from a state like Uttar Pradesh in the north, where the under 5 mortality is 96 per 1,000 live births. That means about 10% of kids die under the age of 5 in Uttar Pradesh. Compare that to Kerala, where the under 5 mortality is 16 per 1,000 live births. That's almost the same as many middle-income and industrialized countries, Kerala. So it's not that India can't do it. We know that states in India are actually achieving the MDGs. It's just that the policymakers across India have not decided to do it. What can we do about this? This is another way of explaining this data in terms of the coverage of key services. You might not be able to read the writing there on the y-axis, but let me explain it to you. On the y-axis, you have critical services like immunization, like skilled birth attendants for women delivering babies. And what the horizontal bars show is the difference in coverage between the poorest and the richest fifth of the population, the poorest and richest quintiles. In Sri Lanka, in the top graph, you see that there isn't a wide width to those bars. It's actually fairly equitable, the coverage from the richest to poorest proportions of the population. Look at the width of those bars in India. And for some of the most critical services, like skilled birth attendants, you see the size of the difference. So the blue bar represents coverage in the poorest quintile, the red bar, coverage in the richest. Huge inequities and really responsible for a lot of the ongoing mortality. So the challenge. We'd like to ask you, as the people that know about this stuff, I'm the person that knows about the health aspects of it, but you're the people that know how to develop and present data. We want you to help us present the data collected in a compelling way that highlights disparities within countries such as India, so it can be readily used by communities and activists to create awareness and stimulate action. We feel that your community is actually there's no community better placed to stimulate this sort of democratic action for change that's required. So the challenge is to you now to go and take some of this data that we've given you in the country profiles. We'll give you extra data that goes state by state for places like India. And we'd ask you to help us develop ways that present it in a compelling way that stimulates communities to agitate and be activists for change. And the next step would be that you would nominate a couple of people here internally at UNICEF who can be your focal people. And we'd ask you to come back with a couple of paragraphs of ideas using the developers and the design communities together. come back with a couple of paragraphs of ideas that roughly outline your plans, and then we'll contact a few of the shortlisted to take it a step further. Thanks very much for your time and attention, and look forward to working with you on this.
Thank you, Peter. So we may take a couple of questions at this point, if anyone has any comment on this. Could you, Peter, say to whom these 2 or 3 paragraphs should be directed to, and if you have a deadline, or how?
Erica and Chris, I'll ask them. You've probably met them many times during the course of the last 2 days. Yeah.
Any question?
Just in terms of a deadline, I'm thinking, how about I send a mailing, like a list out? I'm thinking probably in the next month or so, we'd like to receive all submissions. Obviously, not a final, you know, what you're going to do, but just, you know, what your concept is and where you'd like to go with this.
What's the prize, Erica?
The prize is you go for dinner. I'll buy you a drink. No, the prize is, I mean, we have to see, you know, in terms of what's involved and sort of the resources needed to do this. But also you want to talk a little bit about the dev kits that we have?
Well, one of the things that we thought would be very interesting is if we can get a few from this community, a few of these ideas, and if any of the developers or designers have questions now, we could talk to, sort of address them to Peter in terms of what the next steps are programmatically. But if we could get a few good ideas and we can get something that works, that you can build a little prototype of and show it to us, because we're not the technical people. You know, we can say this might or might not work, or we could change this and that. But if we could have a prototype, if we could have a rough idea of where you would go, then we might be able to help bring it to scale. So it's a chance to really incubate an idea and then blow it out to a scale of a country like India.
You want to talk about the dev kits?
All right, thank you very much.